Arizona reaches new highs in COVID cases and deaths. Is it too little, too late? We posed that question to experts at our state's two largest universities who are tracking the spread of COVID-19 in Arizona. This week, Governor Ducey ordering bars, gyms, and other businesses to close. ABC 15's Mike Pelton looking at when we could see the payoff.
Well, experts say it takes a couple of weeks for new measures to show themselves in the data. So we'll see what happens over the next 7 to 14 days. But they note hospitals are very busy and need relief.
We are only at a few percent prevalence in the population. We're only at several percent right now. If that were to go up, it doesn't take much. We could seriously stress the system.
Dr. Joshua LaBear is executive director of ASU's Biodesign Institute and looks at COVID-19 trends.
There's a little bit of a sense, as I mentioned earlier, that there's a little bit of a plateau right now in Arizona, but it's at a plateau at a pace that we cannot sustain.
LaBear says they are working with the state to expand testing to curb a surge in transmission he says the ASU team can trace back to Memorial Day. This week, the governor closing bars and gyms to limit crowds.
To what extent do you think that will impact our upward trajectory going forward? And at this point, given the growth, is it too little, too late?
I'm never going to say it's too late. Anything we do now to limit this virus is going to help us. And we have shown in the past that we can limit transmission.
But how long will it take?
I think conditions are going to continue to deteriorate here in Arizona for the next 2 to 4 weeks. Maybe they won't deteriorate as fast as they might have before some of these measures were taken. But no, I'm not particularly optimistic looking at the short-term future.
Dr. Joe Gerald is an associate professor of public health policy and management at the U of A. He compiles weekly modeling reports and says the new measures obviously don't go as far as a total shutdown.
I'm assuming from the governor's intent is, again, he's trying to mitigate the worst of the consequences being hospital capacity issues. And so we're going to flatten the curve, but not bend it down.
Statewide ICU capacity at 89% full. Mike Pelton, ABC 15, Arizona.